Good day, everyone. Richard Cowperthwait for Northwest Access TV. Thanks for joining us. We've got an hour show coming up, and it seemed like a pretty obvious show to do to me. We've got a change in leadership at the Franklin County Home Health Agency, and we've got the former director, her successor, and the chairman of the board, and happy to have three fine guests on the show. Janet McCarthy, the former longtime executive director of Franklin County Home Health Agency. Janet, good to see you.
Yeah, thanks for having us on this morning, Richard.
Hey, great to have you. Her successor, Andrea Patrick-Baudet. Andrea, congratulations. And I guess CEO, your official new title with the agency. And Mary Lou Beaulieu, the chair of the Franklin County Home Health Agency Board. So thanks for coming on. I think it's going to be a very easy hour to deal with. Poor Janet, talking off air, I think we go back a lot of years, but I think I can even go back to about 1990 and my old radio days when you would come on board and give us flu shots on air, kind of. But anyway, but a long career with home health. How many years as exec director?
Yeah, as executive director, I was there for about 26 years. 26. Yeah, I started working for the agency as the administrative nurse manager in 1989.
Wow.
Wanted to come work in an organization close to home, and I could not have picked a better place to be. So it's given me a lot of opportunities for growth, and then obviously the director leadership opportunity came up, and it's been incredible. Wow.
So about 32 years or so.
Yeah,
if my math
close.
is right.
It would be 32 years in October.
Really? Wow. So good time was this, and again, we'll obviously talk about the pandemic. Sounds like your last year plus has been, I'm sure, most challenging and trying, but just seemed like a good time to retire. Was this in the works for a while?
Yeah, you reach a certain point when you got a retirement plan in place, and it seemed like the right time for the organization as we emerged from the pandemic. There's no real big hot burning issues, Andrea, but plenty to do. You won't be bored. And my family's grown. Richard, you've seen my kids grow up through the years, and wanted to be able to spend more time with the grandkids and doing some of the things that we enjoy. So
in real, I think I asked you before, real retirement?
Real retirement, wow. Yes, real retirement. No alarm clock in the morning, no calendar.
Must be pretty strange, pretty nice, but pretty strange to get used to such a different routine, I would guess.
I don't think I'm going to have any problem.
Yeah. I should note, your fine husband, Mike, certainly one of Franklin County's cider assistant judges. Sounds like he's been a worthy successor to the late Bob Johnson.
Yeah,
sounds like Mike's really gotten into that job.
He's really enjoying the opportunity.
So it sounded like a cool job to me.
Yeah, he's learned a lot, and he's had a lot of very interesting experiences. So
very good. Before you talk to Andrea, Mary Lou, tell us about the again, Janet had obviously given you some time, so a decision, an issue you folks hadn't had to deal with for a few decades. So
yes.
Talk about the search. How involved was the search? How widespread a search did you do for a successor?
We searched far and wide, and we welcomed candidates from other states. We welcomed candidates, of course, from Vermont as well as candidates that were from the organization itself. So we welcome candidates from everywhere. We did, hire someone to help us with the search and really keep us organized and focused, and get us focused as well to be sure we had a vision that was sound for the agency and for the future of the agency. And we were very fortunate to find Andrea with her background and her proximity. Also, Andrea, as you'll learn, comes from New Hampshire, our neighboring state. And so it's all worked very well, and it seems to be what it should be. It was all meant to be the way it all came into place.
How many candidates did you get? How many candidates out there were there?
I want to say we had about somewhere around 10 viable candidates, 10 strong candidates to choose from. So I'd say we had a good body of candidates to choose from, and it was a good competitive search. So I feel very good about it.
Right. I should know we're taping this show on Wednesday, July 14th. Andrea, again, good to see you. Welcome aboard. Nice to have you in Franklin County. When did you officially start work?
So I officially started Tuesday, July 6th.
Okay, just last week.
Just last week. So I am in my second week and really getting my feet wet and meeting a lot of people within the agency and beginning to just now start meeting some of our community partners and really looking forward to continuing to get to know as many people as I possibly can. I think, I also want to be out on the road with some of our clinicians and meet a number of the patients and families that we serve. And
do you hope to do that during your entire tenure or just in the beginning?
Oh,
or?
no, I certainly hope
Really?
to do that on a pretty
Interesting.
regular basis.
Really?
I think it's really important to keep, your finger on the pulse of what's happening to the patients you serve and how are they experiencing the care that you're providing, what's meeting their needs, what could you do better, what challenges they have. I think that's really important. So I don't see that as a short-term opportunity.
Janet, were you able to get out on the road much, or I'm sure you had so much stuff to do? Was that not the easiest thing to do, probably?
No, I completely agree with Andrea. It's just really important to be reminded what it's all about. And, it's frankly, it's what fuels my soul and my heart. And I'm a nurse at heart. And so the opportunity to get out, pandemic was a perfect opportunity, was able to get out to provide vaccinations for folks and, really see firsthand what it's been like for people who weren't able to get out for a long period of time. So, I'm really thrilled that Andrea's a nurse and willing to do that because I think that just will help the organization continue to succeed.
Mary Lou, out of curiosity, were some of the 10 viable candidates, were some of them not nurses, or were they all nurse backgrounds?
They were not all nurses.
Not all nurses.
Yeah, and that was something that was a high priority for us, is to have that clinical background. But not all good candidates were fitting that mold. So,
Andrea, tell us about yourself.
Oh gosh, that's a loaded question, isn't it? So I've been a nurse since 2005. Started my nursing career in the acute care setting, so worked on a cardiac floor in the hospital and loved that aspect of nursing, but found I had an opportunity while I was working in that setting to also provide care to hospice patients that were in the hospital for short stays. And almost immediately felt very drawn to that. And so after a few years, I had the opportunity to go work for a hospice organization in the community, very strong, mission-driven, not-for-profit organization. It's actually the organization that had taken care of my mother at the end of her life. So that was also very meaningful for me and really found my niche there. Really loved being out in the field, taking care of patients as they approached the end of their life. And that was really my first foray into home health care.
And this is all in neighboring New Hampshire?
This was all in New Hampshire, down in the Seacoast region.
Great. I love Portsmouth, one of my favorite places in New England.
We lived not far from Portsmouth in Newmarket, and I grew up in that area. So knew the area really well and just really love that part of nursing. And again, as I went forward in my career, never really anticipated that I would leave the bedside, but really found I also loved leadership and having that opportunity to develop clinicians, develop programs, support the mission, really think about stewardship of an organization, and again, always be thinking about sustainability and the future of healthcare. So I think it's really, that's been a huge piece of what I do. And like Janet said, I think the pandemic as well offered me an opportunity to keep abreast of what was happening out in the communities. I, for a number of months during the pandemic, helped to do some on-call nursing. And so I was out at 3 and 4 in the morning seeing hospice patients and really to help support that team. So I too am a nurse first and foremost, and always have that, I think, central to what I do.
Were you looking for another job? How'd you happen to?
I wasn't.
Is that right? In fact, was there an ad? How'd you even know about the
So
opening?
interestingly, the recruiter that was engaged by the agency to assist with the search
Yeah.
sent me a message on LinkedIn
Really?
and said, here's this great organization in the beautiful state of Vermont, and you look like you might be
Really?
qualified. Would it be worth a conversation? And I really kicked it around in my head for a few days because I wasn't looking.
So that just totally came out of the
Totally
blue.
came out of the blue. And,
Yeah.
and I will say that a CEO opportunity was something that I hoped would come my way at some juncture in my career. But I truly was not looking. And so I thought, well, why not? I'm gonna have a conversation. And like Mary Lou said, I think once I got started with the process, things really clicked into place for me in really wonderful, almost magical ways. It felt like the right agency, the right location, and really would be a nice match for me and thankfully for the agency as well. So I feel really lucky that it happened the way it happened.
Interesting.
Yeah.
So Mary Lou, I guess you folks feel like you got the right person, I guess, here, huh?
Absolutely. That's something that was really important to us. We didn't want to make a quick decision or feel like we had to make a quick decision, and we gave ourselves enough time to make the right decision. And I feel very fortunate for the agency that we were able to connect all the dots and everything came into place as we hoped it would. So we feel very confident about our decision.
Boy, Janet, we could talk for hours about your tenure, but looking back, it sounds like it was a great job. It sounds like you had hopefully the ideal job for yourself. But changes, I realize we could talk for a long time about a lot of these issues. But is the agency now just very different? I assume bigger. Just a lot of changes over those 30 plus years.
Incredible changes.
changes.
When I started in 1989, we had 52 employees.
Really,
We've
52?
made 52 employees.
And now we're talking.
We're talking about 140, I think.
So about three times as big.
So
Wow.
the budget was $500,000. We just approved an almost $10 million budget this year.
Really? Wow.
I think the agency made 20,000 visits that first year, and now we're making 70 to 80,000 visits throughout the county.
Wow.
We had, home care was the first program, and then hospice. When I started, was only 5 years old. It was a baby. It was in its infancy, and now that program has grown quite significantly, serving about 20 to 25 patients a month on hospice. And our other big programs were the long-term care programs now. So, when I started, that was really tiny. It was a bit of the black sheep of the organization, and now it's become almost half of our budget, providing care to people who would otherwise need to live in a nursing home. So lots of changes from a size perspective, lots of changes regulatory-wise, the general healthcare environment. Healthcare reform is a really hot topic now, and so for me personally, it was a wonderful opportunity. I never felt like I needed to leave a job to learn something new or have a new experience. There was something always changing, and it's been great. I've loved the people I've worked with, and we work in I was telling Andrea this morning, we have a very unique community, very tight from a healthcare leadership perspective. We work closely with the Northwestern Medical Center and Northwestern Counseling and Support.
Of course, Notch has been one of my good friends is on the Notch board, and just the numbers he throws at me.
Yeah.
Notch has become a pretty big player in Franklin.
Absolutely.
And Randolph County.
Yeah, you think about where Notch started. It's just a little tiny shell of they've really grown and expanded. So it's been a wonderful community from a professional perspective, and and I was really happy to turn the keys over to Andrea last Tuesday, and I've had an opportunity to spend some time with her during the last week or so.
I suspect you might get a phone call once in a while from Andrea, perhaps. You think?
Yeah, I hope I do. I hope I do. And I hope it's things are going great. Thanks for leaving me in good shape.
Yeah. Mary Lou, how long have you been a board member, now board chair?
Been a board member, I want to say 4 years now, I think.
Yeah.
Janet, do you remember when I started?
You're close to 5.
Okay, could be. Time
Yeah.
flies when you're having fun. Anyhow, but it's been excellent opportunity for me. I've learned so much about home health care. I've been in other areas of healthcare, and so this really has been good to round out my experience in healthcare.
You
And
mentioned a number of years at Northwestern Medical Center.
correct, yes. And from there, worked for a national radiology group, and now I work for a group that provides assistance to physician practices all over the country. So. I've been the board chair for a year since last year, since September of last year, I believe it was. So it's been a wonderful experience. Janet has really made it easy to be in this role. A little bit more difficult when she announced she would be leaving. It was
you
oh
announced that a
boy.
while ago. I'm sure you gave these folks some time.
She did, absolutely. And Janet was so well prepared. And we were very thankful that she was there throughout the pandemic and continued to ensure everything went smoothly and didn't, decide to make the announcement sooner than she did. We were very thankful for that. So
We talked off air. So a big board. You tried. There are board members from most of the 15 municipalities in Franklin County.
that
So
is
a pretty big board.
Yeah, it's a goal to have folks from all of the different towns in our area.
Yeah.
Absolutely.
So then the pandemic. We could talk for hours about the pandemic, but boy, that's how difficult was just dealing with the pandemic with all your services and stuff. Did that just all kinds of changes? But
Well, it was there's no question it was challenging. As it was challenging for everyone who
Right.
works in healthcare, education, there was no one that was unaffected by it. But I think our response was just about as good as you possibly could get. So we were watching what was happening with the coronavirus in January. We were thinking,
so a couple months before.
yeah,
going
just
back to,
just kind of keeping an eye on it. And
Right.
in February, the former CFO came to my office and said, I think we should start ramping up and getting more gloves and masks. And that was before there was even any cases in the United States that were known cases in the United States. So we did that, and quickly started realizing that the gloves that we buy were made in Malaysia. The masks were coming from China. And so we really tried to get ahead long before there was a national emergency called. I was actually away in beautiful Phoenix, Arizona, when the first Vermont case was identified, and the clinical director Ella DuPont texted me to let me know, and I said, set up incident command. And so, the team really came together despite my absence and just really started figuring out how do we protect our staff, how do we protect our patients, and deal with the challenges that the pandemic presented to us. And there were many of them. Many of our employees experienced childcare issues, and our pediatric rehab staff said, we can help with that. And we set up a short-term daycare so that our employees had a place to bring their children so they could continue to work, so we could continue to provide care. So that's just one example of how, the agency stepped up to the plate. Another is really implementing telehealth. So utilizing technology to make sure that we stayed connected with our patients, particularly those that were isolated. We couldn't provide telehealth for every patient because many of our patients needed hands-on care, dressing changes you can't do over the phone lines and so forth. But I think we tried really hard to make sure our patients felt connected and supported during what we know was a really challenging time for them as well.
And will telehealth, will that be part of, I can only assume the pandemic has changed the way you're going to be doing things to some extent. Will telehealth be a much bigger component in the future, presumably? or-
I would expect that it would
Mhm.
be, you know,
Yeah.
I think, you know, despite the challenges, there have been some silver linings, and the expansion of broadband, even in Franklin County, has been one of those silver linings. The opportunity to, you know, really maximize telehealth. Many of our employees worked remotely for months, or at least part of the weeks or part-time. And that presents itself with another fabulous opportunity for the agency to use technology, minimize our space needs, but still get the work done in a productive manner.
Mary Lou, staffing, it seems like a huge issue for everybody around Vermont, probably around the country, just labor shortage issues. Has that been an issue for home health? Is staffing pretty challenging just to keep up the staff you need? Is that pretty challenging these days?
Well, you know, historically, there's been some challenges there. I would say right now they've done a really good job keeping the staff that they have, and there are still positions that are hard to fill, and it makes it very difficult in our current environment to keep those positions filled. So I'd say it is a challenge. It's not one that is crippling the agency, but it definitely is a challenge. It is, I think, globally, you know, across the United States, at least, it's been a challenge in all of healthcare. Is
Andrea, were you running into that in your last job? And I mean, it sounds like everybody's running into that.
Yeah, absolutely. I think in many of my conversations with Janet, I think we've discovered some really common experiences, not only during the pandemic, but coming out, you know, hopefully the other side as well. So I think, you know, many of the same challenges around childcare and needing flexibility. Certainly some employees who really, I think, felt the benefits of remote work. I think that's something that will be a challenge well into the future, trying to reconcile what are the needs of the agency, what are the needs of the community with, again, space needs, efficiency, you know, and really helping to support the flexibility that our workforce really wants and needs as we go forward. Similarly, I would say a lot of the same challenges around the isolation of our patients and families. You know, as I think back to the beginning of the pandemic, and really just the fear and anxiety that people had, knowing they needed the care, but really afraid to let us in. Because what would it expose them to? What would it expose their families to? You know, those were some really hard days. And I would say too, we talked as well about, you know, the challenges we all had at the beginning of, you know, I can remember days where, you know, we would be really staying on top of the most recent guidance around the pandemic and, you know, putting out guidance to our clinical staff based on what was coming out from the World Health Organization, from the CDC, from our local departments of health. And, you know, we'd write new guidance and we'd just be getting ready to hit send to put it out to our teams. And then they would put out something different. And so we would go back to the drawing board and rewrite again. And I think, you know, I've talked a lot with folks over the last year and a half about the challenge of that at the beginning, of that feeling of none of us have ever done this before. This is unprecedented in our lifetime. That feeling of shifting sand, that we don't really know which guidance to follow. We don't really know where this is going, how bad it will get. And that was very, very anxiety provoking, particularly for clinicians in the field who absolutely wanted to keep providing care, but needed to feel that they were safe and protected. And so the challenges of keeping good supplies of PPE, I think all healthcare providers really lived that and spent a lot of late nights trying to obtain what we needed, in Saturday mornings trying to scour the internet for what was available or work with our our state partners to see how they could support us. And I can remember days where the National Guard would pull up in front of our building with a delivery of PPE, and we would just cry with relief.
Really? Well, and there certainly has been some, especially about masks. It seemed like there was more than a little confusion about masks, whether people should still be wearing them. Do you feel, and the Delta variant, of course, nothing I have to tell you folks, but that seems to be an issue. I just heard on Montreal radio this morning concern, I guess this is a reference to Canada, but the Delta variant becoming enough of an issue that the thought that maybe we better get back into some restrictions. Have you got that sense?
Yeah, and I suspect that there'll be more variants that emerge as time goes on. But if I could put in a plug for immunization, this is the time to do it.
Put in a plug for anything.
Because there is evidence that shows that immunization against the coronavirus is effective and preventive from the variants. So
and Vermont's certainly done. I mean, supposedly the safest or the best state, in about 83% vaccinated.
Yeah, I think that's the latest number is 83%.
But that still leaves a lot of people. Janet, are you? I mean, you've been in the field for forever here, but what seems to be the issue for most people who won't get back? Different reasons. Have you got any feel for that?
Yeah, there seems to be hesitancy about, still not quite fully approved by the FDA. Yeah. So, I've heard many people are waiting for that full approval before they'll seek it. There's just a variety of reasons. But, the state of Vermont, I think, has provided all Vermonters with lots of opportunities. There's walk-in clinics every single day somewhere in Vermont. And, like I said, I'll just put in a plug for vaccination at this point. I'm proud of our organization. Before I left, we were at 95% of our employees had been vaccinated. So that's really high numbers.
So you didn't make that. Could you have made that a requirement, or is that just something you don't do? Did you think about saying, hey, a mandatory requirement, if you're going to work for us, you have to get vaccinated, or?
We did not make it a mandatory requirement, but we provide a lot of education and encouragement to our staff.
And most people got vaccinated. That's right. New Hampshire not faring quite as well as how do you think New Hampshire's done quickly, Andrea?
I think overall New Hampshire's done quite well with vaccination. I would say the same kind of, some folks are just very hesitant, I think based on it's a new vaccine. So what are the longer term effects? And there will always be a very small subset of folks for whom there is a reason why they should not be vaccinated. Yeah. That's a normal, I think, event. But, to Janet's point, I think the vaccine is very, very safe. It is very effective. And what do we know about viruses? They do like to mutate. Yeah. And so those mutations will continue to, I think, evolve until we get to a certain mass of vaccination. So, it is important that we keep stressing the safety and efficacy of the vaccine. The organization I came from in New Hampshire, quite a bit larger, had about 500 employees, and we were not nearly as successful in vaccine uptake by our staff, which was and is, I'm sure, still a great concern. And so there are a lot of efforts, I think, continuing there to keep working on that. And really, I think it's important that we understand for that smaller subset of folks who are hesitant, what that hesitancy is, and hopefully helping with education to work through that with them. Yeah. Because again, the vaccine is very available and very easy to get, and very few serious complications. Yeah, Mary, you feel the agency has done pretty well, and it sounds like on the vaccination front. Then
absolutely, earlier on in the pandemic, when testing was a big deal, Janet and her team were all over that, and they had a process of testing in place that was, went beyond, I think, what many other organizations were able to do. And then when the vaccine became available, they were on top of that right away and made it available to staff as soon as possible. And I think did a fine job at ensuring every step of the way throughout the pandemic, they tried to stay ahead of and go above and beyond to be sure staff were safe, to be sure patients were safe, and they communicated that very well as, to top that all off. And I think that's what probably contributed to the success of, the high numbers of staff that are currently vaccinated, because of the communication, because of the education, because of the constant messaging and making sure people were in the know of what the right thing to do was and what was going to be safest for themselves and their families.
Do we know the percentage of Franklin County residents vaccinated? Is there a county by county breakdown on that? Do you know?
There is.
I guess I've seen that. I think the Northeast Kingdom is kind of
I
lower.
think Northeast Kingdom is struggling a bit with that, and I think Franklin County is more average across the state. Yeah, not at the top, but is in the middle of the pack.
Yeah. So you mentioned about a $10 million budget or so these days for home health, and I can remember talking to you going back many years, just budget issues coming up, I'm sure, all the time. But maybe talk about that a little bit. We're talking a mix of funding sources. You get some local support, you get some bucks from towns at town meeting, you try to get some money from all the towns, but there's, I'm sure, a mix of many sources here.
Yeah,
always a struggle.
Yeah, always a struggle. As with our mission, we're a nonprofit organization, and we serve those who need home care. Most of our funding is Medicare funding, running about 50% now, a little higher than 50%. But we also have quite a few folks in our community that have Medicaid, so low-income Vermonters. And last I knew, we were about 41%. I'm not sure where we're at right now, but it's a high number in the state of Vermont, and hard to make ends meet when you serve that number of Medicaid recipients. But we have commercial insurance, Blue Cross Blue Shield, Cigna, the MVPs, but we do rely on fund development efforts, so assistance from our towns through the annual budget allocation process. Very grateful for our town support at town meeting day, and other sources of generous donors, local community folks that drop a check in the mail to us from time to time, and it's really makes a huge difference for us.
It's really noticed on obituaries, a number of people, just organizations that recommended to send, donations to. Certainly home health is
very grateful for the community support.
I can only assume that's a not insignificant amount of money.
I always say every dollar counts, and by the end of the year, it is significant.
Yeah. So budget, is this kind of a new line of work for you to be dealing with a $10 million budget, Andrea, or not so much? You're a good money person?
Well, I've learned my MBA program was great for helping me learn a lot about finance and accounting. And, having had responsibility for about a $13 million service line budget in my hospice program in New Hampshire, helped me feel well prepared to manage a budget the size of this one. But again, I think, a lot of my responsibility right now is to really dig deep into all of those numbers and understand where the different programs and clinical needs feed into that. Because it's really, it's a different payer mix than what I'm used to some extent. Certainly a mix of different programs that feed into that. And so there's just a lot of preparation, that I've certainly started, and just really investing that time into getting to know those numbers pretty intimately and putting all those puzzle pieces together. Like I said earlier, getting to know the management team, who are phenomenal, getting to know the board, who are equally phenomenal, getting out into the community and meeting our partners and meeting some patients and putting all of that together into I hope, a fuller understanding than I have right now in week 2 of operations, and how to, again, sustainability is very, very important. We want this agency to be continued financially strong and providing great care well into the future. So Janet's legacy is tremendous, and I have huge shoes to fill. And so
Only size 8.
also my feet are bigger, but really want to. It's been tremendous to have the opportunity to learn from her over the last few weeks, and she is in my speed dial. Should I need her in the future, but I also want her to enjoy her retirement and really have that time. She's earned it, and so I'll be judicious about that. But there's a lot to learn, and again, for me, coming from another state, although it is a New England state, Vermont is very different, and so again, there's a real opportunity as my husband and I, move here and get to know the community to just really get settled and dig into how we can make a difference.
In Vermont and New Hampshire, of course, have 2 Republican governors, Phil Scott in Vermont, Chris Sununu in New Hampshire, kind of different styles, but two folks who get plenty of attention. Mary Lou, of course, the agency has a chief financial officer. As much as Andrea will be delving into the budget, you still have a CFO also.
We do.
Yeah. But boy, budget issues, I'm sure that gets obviously plenty of the board's attention. I guess always an issue.
Absolutely.
Just to stay afloat or stay
Yes.
afloat easily or whatever.
Yes, absolutely. That's something that we really want to be sure is sustainable. So I heard the word sustainable already, but that's a focus of ours, is to ensure that what we do now is sustainable, to the decisions we make now are ones that will carry us into the future and will prepare us for our future. The agency has done a terrific job dealing with the different payment reforms that have come through and planning for them, preparing for them, ensuring that they have the right education in place for staff to make sure that documentation is what the new regulations call for in order to earn the reimbursement that we need to make for the services we provide. So all of those type of things, have to be in place for the agency to be successful and sustainable into the future. So
I think the agency is very, very well regarded. Nothing I have to tell you. I think it's got just a lot of support. I do hear complaints about probably anything, and I sure don't hear a lot about home health. I have heard some folks say, well, it'd be nice if we're told that a nurse is coming over. Sometimes, we don't know when. I guess, I don't know if they'll say we'll be over in the afternoon or morning, or I've heard people say, I wish I could nail that down better. And sometimes I'm not getting a call back as quickly as possible, but I guess maybe you can say that about any agency, but does that ring a bell at all or not particularly?
Not particularly.
No.
I have not heard that.
Not really.
Maybe Janet or Andrea can speak to that better.
I would say that is an opportunity to always look for improvement. There's always a backstory, and sometimes the nurse is delayed because she's arrived at a patient home and needed to deal with some issues that were unexpected.
Right.
And, it could be, very significant crisis or whatever. This is construction season, and manure spreading season is always a bit challenging because you get held up with traffic. So there are things that come up that are
and road
unexpected.
work and road construction in the summer.
construction.
Georgia certainly has had a share of that.
Yeah. Yes, so I've discovered all the back routes to get around to Route 7, but it's beautiful. So it's definitely an opportunity and something that we're always trying to work hard at. But things do come up.
Sure. Do nurses, if a nurse is seeing a particular patient, does that change sometimes? Do you try to have the nurse see that same patient for a long period of time, or do you purposely make a change at times with that?
We try to keep the staffing consistent, but there are vacations that come up. People have unexpected time off. They may be called to another patient, and so we need to do a little bit of juggling. But our nurse staffing is such that we've been able to make improvements in consistent nursing staffing and looking at developing little teams and little pods so that patients know their team and the team knows them.
Yeah. course, Franklin County, Vermont has what, the oldest demographics outside of Maine. I can only assume New Hampshire's probably there too, but just kind of an aging population, which I guess gives home health more work to do or more challenges, I would guess. Huh?
Yes, we are getting older.
Yeah, hey, tell me about it. I'm not looking at you any more than I'm looking at myself.
Thanks, Richard.
But again, plenty of challenges. But that's
there's never a dull moment
Yeah.
in home care, and there's never a dull moment in healthcare, but definitely never a dull
Sounds
moment
like
in home care.
I realize you're just very recently on board. Andrea, any changes that come to mind, or maybe nothing you want to throw out so quickly, but you're coming from a bit of a different background, but can you think of any, maybe a little different focus you might want to give the agency, or is that a little too soon to ask you stuff like
I think
that?
it's too soon to ask me that. I think,
can understand.
in my conversations with, actually with everyone, with the board, with the management team, and with staff, what I have really pledged is that unless something absolutely categorically has to be changed,
Yeah.
let's just say for a regulatory reason in the next 90 days,
Yeah.
my goal right now is to observe and listen and to really get to know the lay of the land before we
Yeah.
even consider any large changes. I would also say that, in week 2, I'm not seeing the need to make any large changes. So I don't anticipate any. I think one of the things that we are always prepared for is, again, regulatory scrutiny is very much a part of what we do. Certainly, I would say, home health is quite accustomed to a number of regulatory hoops to jump through. Hospice, I think, has caught up in the last few years and are definitely on the radar for the right reason. We need to be providing quality care and quality outcomes, and being good stewards of healthcare. So that's not a bad thing, except of course for the administrative burden associated with jumping through those hoops. But I really am hoping to have the opportunity to just really get my feet wet and evaluate the needs before we look to any large changes. The only thing I would mention as it potentially on the radar, I think, and we touched on this earlier as we talked about telehealth, is as the connectivity in this region gets better over time, I think we may have the opportunity to leverage more technology, which is helpful, I think, even for staff who could perhaps start and end their day more remotely, spend less time back and forth to the office to pick up supplies or to get a piece of paper or those kinds of things, which would allow them to perhaps see another patient that day. And we know that as the population ages, there will be more folks that need us. And we have, again, we've got to keep doing our very best to recruit the best people and have a really strong, educated, capable workforce. So I think those are the things I think about. But my goal truly is no changes for as long as I can possibly manage that. I've got a lot to learn about this area.
A nurse, how many patients will a nurse typically, I realize there's probably no typical, but just one of your nurses, how many patients will that nurse see in a day? What's the most number of patients typically?
Yeah, typically a nurse will see an average of 5 or 6 patients. An admission visit will take longer, so there's an adjustment made to the schedule to reflect that.
Yeah.
It's typically what they see.
Yeah. So had you stayed on longer, and I'm glad you're happy that you retired when you did, would there have been any big changes or noteworthy changes you would have been looking to do, Janet, or is that a
I think
question?
Andrea hit the nail right on the head.
Yeah.
Really capitalizing on technology opportunities, particularly as broadband expands in the community. We're really hampered right now in that northeastern part of the county. Enosburg, Montgomery, Richford, Berkshire. It's very challenging.
Boy, it sounds like that's been an issue for forever. It sounds like it's hopefully getting more attention.
Yeah, and it's better.
It's better.
It's definitely better, but I think that's really a big thing. And I'd be keeping my eye on the workforce issue. We've talked about that. Here I was reflecting about the nursing shortage that we're experiencing today is so different than in 1992, 93, 1994 when. It was very, very difficult for nurses to find jobs in Vermont.
Really? Is that right? Just a total...
completely different. There's a whole group of nurses that graduated in those years that were not able to find jobs in nursing for 3 to 4 years.
Right.
And now there's, 3,500 nurse vacancies posted on Indeed. So,
I know Northwestern Medical Center, has visiting nurses. Do you folks rely at all on visiting nurses, or are these just all... your staff, just folks who are here?
We have had experience with traveling nurses.
Traveling nurses.
We've not had traveling nurses for 2 or 3 years.
Yeah, it's been a while.
All right.
Yeah.
I think we felt strongly. First of all, they're expensive,
right.
So that hits the bottom line in a hard way.
Yeah.
But secondly, just developing that relationship with the organization and the commitment to our mission is one that we don't quite see happen with traveling nurses. So we've done everything we can to recruit a strong workforce and keep them.
Right. Mary Lou, down to just a couple of minutes. Again, it sounds like you're very happy with Janet's successor, but I can only assume you're going to miss Janet. Pretty solid job there for many decades, huh?
Absolutely. Janet has been a gift to this community and will continue to be, I'm sure. That's no doubt. She's not going anywhere. Unless it's the vacation here and there. But we're so happy to have her in the community, and we're so fortunate to have had her in this role for so many years to build the strong organization that it has become and to serve the people in our community. She's really set a strong foundation for that, and I'm sure it's one that Andrea will appreciate as well in her many years before her.
Yeah.
So.
But Andrea, it sounds like you've taken command. Sounds like you're pretty psyched about your new big job.
I'm incredibly thrilled to be here. I feel very honored, truly, to have been selected, and it's just it feels like a really nice match for me. Again, a very strong, mission-driven organization that does wonderful, wonderful work, and I just couldn't be more thrilled.
Have just a minute and a half. Janet, over 30 years, any one or a couple moments that come right to mind as your kind of top moments with home health? And I realize you could talk for hours.
Oh,
on
I
this
could.
stuff,
You'd have to invite me back, and I'll take the full hour. I've had incredible stories. Just really mostly centered around the challenges that our staff have overcome. Taking a boat out to Burton Island to make a visit.
No, really. Wow.
Sitting on the back of a snowmobile, heading up, Montgomery Mountain. Just going above and beyond. Our staff is just incredible, and when I think about my greatest memory is the fabulous people that I've had the opportunity to work with in the last 31 years. It's been a real privilege and honor to work in this community.
Boy, and that's a lot of people. I mean, you got to think that's over about 150 employees now, over 1,000, maybe well over.
At least.
Yeah.
I thought it would be fun to try to figure it out. I didn't know where to begin, but it's been a lot of people.
Wow.
Yeah.
Well, good luck in your retirement. You
Thank
certainly
you.
have a tremendous legacy. And again, Home Health, I think, is a very well-regarded agency around Franklin County. It's certainly been a huge player in Franklin County. Anyway, well, thank you all for your time.
Yeah.
Janet McCarthy, the former longtime Executive Director of Franklin County Home Health Agency. Andrea Patrick-Baudet, her successor, the new CEO. Mary Lou Beaulieu, the chair of the board. Thank you very much for the time, and good luck to the agency and all you folks. Thanks for watching us. I'm Richard Cowperthwait. See you next time.